Many soft drinks manufacturers have already reduced the sugar content of their products. Credit Peter Daisley. Britain's sugar tax will succeed in improving health among poorer people, the findings of a major international study suggest. So-called sin taxes, such as the soft drinks industry levy, which comes into force on Friday, are more likely to alter the behavior of less well-off consumers, the research published in a series of Lancet articles found. At the same time, the bulk of the financial burden imposed by such taxes tend to be borne by higher-income households. The biggest research project ever of its kind, the study described non-communicable diseases, NCDs, such as heart disease, type 2 diabetes and cancer, which are all related to diet, as a major cause and consequence of poverty. It concluded from data gathered in 13 countries around the world, all with large populations, that taxes on unhealthy behavior could result in major health gains. The evidence shows taxes can be implemented fairly, without disproportionately harming the poorest in society. Dr. Rachel Nugent. The study cited the introduction of a sugar tax in Mexico in 2014, which resulted in a 4.2 liter per person reduction in consumption in a year and 17% fewer purchases among lower-income people. By contrast, consumer purchasing hardly changed among better-off groups. Announced by George Osborne in 2016, the British SDIL will impose a levy of 18p per litre on soft drinks containing 5 to 7 grams of sugar per 100 milliliters, and a 24p per litre for more than 8 grams per 100 milliliters. The tax is designed to encourage manufacturers to remove sugar from their drinks. However, it is also likely to lead to price rises among products which have not been reformulated, such as Coke Classic and Original Pepsi. Fruit juice and milkshakes are exempt. More than 50% of manufacturers have changed their formulas to cut sugar, according to figures last month from the Treasury. Dr. Rachel Nugent, RTI International in Seattle, who chaired the Lancet team, said, "Non-communicable diseases are a major cause and consequence of poverty worldwide. Responding to this challenge means big investments to improve healthcare systems worldwide, but there are immediate and effective tools at our disposal. Taxes on unhealthy products can produce major health gains, and the evidence shows these can be implemented fairly, without disproportionately harming the poorest in society." The study comes as new NHS data reveals obese women are placing an increasing burden on the NHS. Hospital admissions due to obesity have soared, and women are accounting for the lion's share of hospital spells, according to new data from NHS Digital. More than a quarter, 26%, of English adults are obese, including 2% of men and 4% of women who are classed as morbidly obese, meaning they have a body mass index (BMI) score of over 40. New figures from the Health Service Data Watchdog show that, across England, hospital admissions directly attributable to obesity rose by 8% between 2015-16 and 2016-17. There were 10,705 admissions where obesity was recorded as the main cause of admission, an increase on 9,929 admissions the previous year. Almost 3 in every 4 patients, 72%, were female. The trend coincides with a 19% drop in the average number of walking trips undertaken by adults. Meanwhile, the number of hospital admissions where obesity was listed as a factor also increased significantly. Mapped, the global epidemic of lifestyle disease in charts, there were 617,000 admissions to English NHS hospitals in 2016-17 where obesity was recorded as either a primary or secondary diagnosis, an 18% rise from 2015-16 when there were 525,000 admissions. 2 in every 3 patients, 66%, were female, according to NHS Digital's latest report. There were 6,700 bariatric surgeries conducted in hospitals across England in 2016-17. 77% of these procedures were carried out on women. Responding to the figures, Professor Russell Viner, president of the Royal College of Pediatrics and Child Health, said, "These latest figures reinforce the urgency with which we need to tackle obesity in childhood in order to reduce the strain on an individual's health, as well as health services, later in life." Protect yourself and your family by learning more about global health security.